All right. Now, sorry. Now, we're quickly trying to look at ovarian tumors, right? So we're about to start discussing about them, mostly focusing on the classification, talk about all the types of ovarian tumors and all. So before we do that, we just want to look at what? Introduction to the whole concept. Introduction to the whole concept of what? Ovarian tumors. So let's look at this. We said that ovarian tumors, of course, a tumor is an abnormal growth. Ovarian is in the ovaries, okay? So they range from what? The ones that they will just be there, they can't spread to another place, no problem, to the ones that can spread to other places, they are cancerous. So if you understand their nature, it will help you to be able to dictate them, it will help you to be able to treat them very well. So what are ovarian tumors? There's so they're just trying to define ovaries first before we go into the tumors. So ovaries, of course, okay, these two, small things this side, when it becomes cancerous, you can see how big it is becoming. So there are two organs in the female pelvis. They produce eggs and hormones like estrogen and progesterone. So if there's tumors in the ovaries, it can originate from what? Any part of the ovary. It could be the outer lining, it could be from the cells that produce eggs, it could be from the stromal cells. Okay, so you see all of this, right? So what are the different types of ovarian tumors? This is based on what? Their activities. Okay, if it is benign non-cancerous, if it is borderline, is in between being a cool guy and being a harmful guy. If it is malignant, it has the possibility of like spreading to other parts of the body. Okay, so symptoms to watch out for. People that have ovarian cancer, you can see how big it is becoming. So it can make your stomach to blocked. All right, abdominal swellings, pelvic pain, abdominal pain, difficulties eating or you feel full quickly, then urinary urgency or frequency. So most of these times, if you want to diagnose them, it just range from what? Imaging, blood tests to check out for any biomarkers. Then you do biopsies where you're taking some tissue, send it to the lab to further confirm. Then histology, that's where you now employ your microscopes to actually visualize the main thing happening. So these are the risk factors. They can develop because of your age, they can develop because maybe these tumors was run in your family, they can develop because of some genes are not nice, they can develop because of hormone therapies, some drugs that you are taking, they can develop because your body weight is too big, all right, or you have never had children before. Okay, so this serves as an introduction. We'll go into it talking about the different types of ovarian tumors real soon.